We're broadcasting. I will watch the count as it goes up so that we can welcome everyone on that's going up right now. So I know we have some great topics to talk about today, and I really want to thank everyone for coming on. Guys, if you're signing on right now, we're just going to wait till everybody gets on so we can start. We have a great panelist for you today that are going to really share some good information about what they're doing differently in their office, and how they're handling it as office managers, and dealing with the issues that are coming up either from the team side or from the patient side. I guess something that's really on your plate that you have to deal with. So we're super excited about this. So I am going to go ahead and get started because I want to make sure, I know Chuck has a lot of great questions that we want to go over with you guys. So I want to go ahead and get started right away. Again, thank you for joining. My name's Kay Huff with Benco Dental. We have an amazing afternoon, or an hour planned for you. And I want to introduce our moderator today, which is Chuck Cohen, the Managing Director of Benco Dental. Chuck, we're excited about having you, and thank you so much for the time that you're spending with us today. We really appreciate that.
I love this group. Office managers are some of my favorite people, and we have a very august panel today. I think everyone will be very impressed. We totaled it up before we started, and in total, there's over 100 years of dental experience on this panel. That does not include me. I'm just the moderator. I am not an office manager, but I'm looking to learn today like everyone else. So great. Kay, you want to say something?
One more question. I just forgot about the Q&A. So guys, as we're going through this today, if you have some questions that you want to ask, please make sure that you use the Q&A, and Chuck will be watching that over and answering some of your questions live. So that's all I wanted to say, Chuck. Go ahead.
Thank you. That's great, Kay. All right, so let's get started by having our panelists introduce themselves. Marsha, why don't you start? Who are you? Where is your office? What do you do? And just a sentence or two about how you got to be an office manager.
So my name is Marsha Pilgrim. I'm in Wisconsin, Eau Claire, Wisconsin, over on the western part of the state. And I am married to a dentist, so that's how I got into this position. Someone told me if I married the doctor, I would never have to work again. And 6 months in, I took over an office that was an office manager that left. So I've been an office manager now for 38 years.
38 years of never working again.
Yeah.
Glad you're here. Excellent. Elizabeth, could you go next?
Yes, sir. Excuse me. I'm Elizabeth Toller. I'm from Warner Robins, Georgia. I started in dentistry at age 16. So I've actually been an office manager about 25 years now. It was an after school job at age 16, and I never looked back.
Great. Thank you. Welcome. How about you, Amanda? Let's see. Amanda, we're having trouble with Amanda's internet. How about Beverly? Why don't you go next?
Hi, so I'm Beverly Wilburn. I manage a perio and implant practice right outside of Washington, D.C. We have 2 locations, Maryland and Virginia. And I started as a dental assistant, and I lasted 1 day about 19 years ago. And I said, either put me up front or I'm not going to be in dentistry. So that's how I ended up at the front desk and ultimately an office manager eventually. And today I'm also the executive administrator for the Virginia Society of Periodontists. And so enjoying dentistry in general and just love that role. It's a great, great place to be.
Thank you, Beverly. That's great. Nice to meet you. Amanda, how about you? Oh, Amanda's kind of frozen. We're having internet connections with Amanda. All right, so Amanda? All right. Well, let's, oh, go ahead. Oh, bad. All right. So, not really. All right, so Amanda, let's put you on mute.
Yes.
And then why don't you go on mute and then see if we can get that resolved. Now we can.
Can you hear us? Can you hear us?
Yes. Yes, kind of. All right, well, let's get moving. Amanda, let's see if we can get a better connection for you. What we don't want to talk about today for the next 58 minutes or so is just how we're going to complain about not getting enough PPE and other things. We want to sort of move forward. So we are blessed today to have one of our panelists, Marsha, having dealt with what I think will be, if it's not already, one of the most challenging pieces of our job as office managers going forward, and that is dealing with an associate, a staff member who has actually come down with COVID-19. That's the world we live in today. So it hasn't happened very often yet, but I know from my conversation with Marsha beforehand, and my conversation with Kay, Marsha's office actually had to deal with this issue. So Marsha, can you take a few minutes and walk us through how you found out, what happened, and then let's have a little discussion on what to do, because it was not as easy as, oh my God, we found somebody with COVID-19 and now we're going to move on to doing business. So talk a little bit about that, that challenge.
So so we opened up about 4 weeks ago, and we had a week of training. During training, one of our staff members mentioned her husband had been sent home from work, thought he might have it, but they weren't interested in testing him yet, according to the health department. They finally did test him, or he went in and asked to be tested because he had small children, was tested, got the results 4 days later. And I called the health department to say, what do we do? This is a staff member's husband, so we know they're in direct contact. They were like, it's a contact of a contact, just wait it out and see. Just make sure that everybody has a heightened awareness, taking their temperature, doing what they need to do, and that we're all wearing our protective gear and things. So we did that. Well, then 3 days later, we found out that he got a call at lunchtime that she tested positive. So then that kind of threw everything into chaos. So she immediately had to leave work, pick her children up from daycare, head home, and be quarantined for 14 days. Wasn't asked to be tested, but just because the husband was positive, she needed to be home because she had a direct contact. So then we asked, what about for us? And then it was a matter of, well, we're all in contact of a contact. So there wasn't concern other than to keep having heightened awareness, keep taking our temperature and keep figuring out, keep an eye on what's going on. So we did that. 2 days later, she decided to be tested, her symptoms. She luckily got her results back within 24 hours and tested positive. So then the health department contacts us, and it was a matter of, who has she been in contact? What is your contact? What kind of face mask did she have on? Luckily for us, her N95 did not have a valve on it. So there wasn't a concern for our patients, but there was a concern of staff because we had all eaten lunch in the same room together. Even though we were 6 feet apart, we didn't have a mask on. So that meant everybody that had been in the room with her had to be quarantined. So we ended up on 14 days of quarantine. Myself, my husband, and our dental assistant were luckily the only 3 in the room with her at the time. So spent 14 days back and forth with the health department calling us. We had to be home. We had to send them our temperatures every day. And then it came back. So the first day it was like there was no concern for our patient because she had on the N95 mask. She had a face shield on. Everything was being sterilized. We were not having a lot of contact other than patients coming and going. But then the next day the health department called and said, no, the state has decided that because she worked on patients, our patients needed to be contacted, and they were going to have to quarantine for 14 days. Fortunately, she had only had 2 patients because 2 of them didn't show up, which was an answered prayer for us. But the first patient is a gentleman who had just gone back to work. So then there was concern, what happens now? He's out of work for 2 weeks. Who's responsible for his wages and him being off work? That was a question that came up. The other one was an 87-year-old lady who hadn't been out of her house except to come to the dentist, and she wanted to come back and see us. And so then there was concern for her. Back with the health department, we contacted malpractice carriers, and didn't get a lot of definite answers. It was really an open field about, nobody would come up and definitely say, yes, to do this, no, don't do that. We even contacted the Dental Association. It was still kind of iffy about what we're doing or where we were going. Health department just said, be quarantined. And so malpractice carrier said there wasn't a concern because it's really hard to pinpoint where you got COVID from. Once you walk outside your door, you could even get it inside your house. So there wasn't anywhere to really say, yes, we got it from someplace. So there wasn't a concern there. They advised us we weren't going to be responsible for anybody's wages, and we would just have to go. But they did tell us to call our patients ahead of time before the health department called. So we did that. We made phone calls, told them, there's a possibility you've been exposed to somebody in our office. Because of HIPAA, we couldn't say who or how. We just had to say there was a possible contact in our office with somebody with COVID, and the health department would be calling them. The next day at 11 o'clock in the morning, I get a call from the health department. They've had another discussion, and now they've decided that, no, we don't need to contact our patients. So now we've already contacted them, upset them a little bit, but now the health department had to call them and tell them there was no concern. It still raised questions about our office and where they were at. So luckily the patients were really long-time patients, really good about it, and we were good. But, we were out on quarantine for 2 weeks and couldn't do anything. And, it's just kind of crazy world because the health department could never really come up with definite answers. The answers kept changing day by day as we went through this. So it was kind of a crazy confusion time. Even when we came back, the CDC guidelines say your employee has to have 2 negative tests and within 24 hours to come back. So we told the health department that, and their response was, well, we can't do that. We don't have enough tests to do that. So the only thing we can do is give you a letter and say that she's been 10 days past her first day of symptoms. She had symptoms for 5 days. She was 10 days past her first day of symptoms and 72 hours beyond that. And they gave us a letter and said she's good to come back to work. So there's never been any more testing, but it's been really kind of a scary thing because, I questioned, do we let her? Do we not? What do we do? So it's been kind of a confusing area for us, but we just have to keep checking with the health department, keep documenting everything they're telling us and the malpractice carriers, and just go with what we've got because we want to get our business back up and going after being down 12 weeks.
Wow. So Marsha, thank you very much for sharing that story. You didn't have to, and we very much appreciate it so we can all learn from it. One of the interesting things are when you run the numbers as in the United States, over 100,000 people have died, and there's thousands of new cases every day. So it just stands to reason at some point, there will be dental offices across the United States where either a patient or an employee comes down with COVID, maybe not through being in the dental office, but through being in contact with somebody who has COVID. And one of the things I think we should talk about, and Marsha's story is a good place to start, is what will we do as office managers, as responsible parties, to try to figure out the best way to handle that situation? So if I could, let's start with this idea of an employee in your office, a hygienist, an assistant, someone else in the front desk, maybe a doctor comes down with COVID-19. What is the best practice? What should we be doing? Elizabeth, Marsha told the story of what she did. Elizabeth, what's your feeling on that, and what have you heard from the field?
Well, I have a lawyer that he strictly works with dentists. So my first call would be, I know I've got to send that person home. I would probably reach out to him and say, hey, tell me, where do I go from here? And also back that up by calling the health department because they are here in the state. We do have to follow their guidelines. My question would be, if they didn't catch it through the practice or the office or seeing patients, who's responsible for their salary? Or, if they don't have sick leave and they don't have vacation time, who's going to be responsible for that? So that's why I would have to reach out. Now, I do know I reached out to my insurance company, and at this point in time, no one has coverage for the pandemic that happened, in the past couple of months. There is no insurance coverage. However, they are coming up with one, and you can get that as a rider. But is your insurance, your malpractice insurance, your employee insurance, who's going to be responsible for their salaries?
That's a good point. Marsha, could you talk a little bit about, and then we'll get to Beverly, could you talk a little bit about overall how your experience was with the health department? Just in hearing the story, it seems like you were on the phone with them a lot. Were they trying to be helpful? Were they not? I mean, we all hear about bureaucrats and stuff. Did they care? Did they give you just a gobbledygook answer? Talk a little bit about that.
They were really good, and they were trying to help them. They do have a specific line for COVID. So when you call the health department, they do have a special line and have people there that are trained. So they tried to be helpful, but it was just very confusing because one day it's, no, you don't have to. The next day, yes, you do. The next day, no, you don't. Even for us monitoring, they were supposed to send us, we were supposed to be home. We were supposed to be checking our temperature, but we would get surveys every day saying, we're taking a survey of your temperature. Well, I didn't know that that's what it was, and it was just a survey, so I was just ignoring it. So we really never even turned our temperatures into the health department. So it's been really like they're trying to do the best they can with what they've got, but I don't think they even know how to deal with all of it. It's always been confusing. And even now, we're hearing, with the staff, I know my employees, same thing. I'm telling her she needs 2 tests, and the health department's saying no. I said, well, CDC guidelines are saying this. Whose guidelines are we going to go by if something happens? So that was what was really confusing, that nobody had a definite answer to say, do this or don't do this.
Well, one of the things that definitely has come through loud and clear is we're all learning on the job with this issue, and we're all going to get there. Beverly, could you talk, Beverly, could you talk a little bit about what are you doing in your office as far as testing your employees? Because that seems to beg the question of how often should we be testing? Is anyone doing a regular testing? And then Marsha, Elizabeth, and Amanda, you're on mute and I don't see you, so I'm not sure if you're back yet, but we'll just indicate if you're on the line and we'll get you involved in the conversation. But Beverly, what are you doing in your office as far as testing your employees on a regular basis?
So we actually aren't running any physical testing of the employees. We're obviously doing all of the things recommended by CDC and OSHA and all of these, government organizations that are saying what to do. So we are screening, taking temperatures. We're obviously all wearing the appropriate PPE at all times, even when we're alone in the office or other things like that. I think it's a really good point that both Elizabeth and Marsha made, is nobody really knows exactly what's right and what's wrong right now. So I think it's really important just to remember that if we're all doing the best that we can with all of this data that's coming through, and we're all doing the best practices that we can as managers and owners of our practices, then I think we're going to be okay on the safe side of liability when it comes to certain things. I think the liability will be fine in regards to, we won't be liable for certain issues as long as we're doing the best thing that we can. I think if we're out here, there's some practices that may be kind of running amok a little bit and saying we're going to do whatever we want. But if we're doing the things that they're recommending, taking the temperatures, doing the screenings, changing your clothes when you come in, all of those things, I think from a liability standpoint, we're going to be good. I also think that we do need to trust we need to trust our resources. We need to trust our HR companies, our liability carriers, our, those people that we pay all these things to all year long, to now's the time to catch it all in. We need to get answers from those people. So I think that those are good things, but we're not going to test the employees specifically, each one individually. We have personal conversations with our employees as well, where, look, we want to protect you. We know you want to protect us. We're like a family here. So on the weekends, we can't obviously control your lives or what you're doing on the weekends, but if we can all be a little bit safe and try to, limit contact and social distance and do all of those things to keep us all safe, we all want to be here. And I don't think any of them want to close down for a few more weeks either. So I think right now, everybody's just trying to do the best they can and, trusting those resources and trusting those people.
It's a really good point, Beverly. And you said words that made me, what you said that made me think of the next thought is, we're all like family. And I've been in certainly enough dental office to know we all think of ourselves as family. And yet, one of the takeaways that I took from Marsha's story is, how are all of our team members interfacing with each other, right? So like, we all have this tendency to think we're all like a family, and dental offices can be kind of small. So everyone sits down together, eats lunch together. And one of the things that came through loud and clear in Marsha's story was, when people are doing those kinds of activities, it raises the risk that anyone who does get COVID-19 then will transmit it to, or has the risk of transmitting it to, other people on the team. So as office managers, what are we doing to make sure that within the team itself, we're going to make sure that if one person gets it and doesn't know they have it, it doesn't get transmitted throughout the whole team. So Marsha, I don't know if you want to talk to that, but like this idea, the first question they asked from the health department is, who did this woman have lunch with? And it's like, oh, like maybe I wasn't thinking about that.
Yeah.
It seems to me you were a little bit. So talk to that a little bit, I think.
So one of the things that came up is all the rest of my team, because I have a front desk person, another hygienist, came back and said, what about us? We were all together on Tuesday. This came up on Thursday. The health department only went back 48 hours. They only go back 48 hours before your symptom. So she got symptoms on Friday, so anybody Wednesday, Thursday. So Tuesday, but it's still scary for the staff to go, we were around her, are we exposed? One of our hygienists did go get a test on her own. She was able to do that. But it's, same thing. We were saying, at lunch, we weren't concerned because we're in the hallway passing each other. We're in and out of sterilization. We figured we were all being cautious with our patients. Didn't even think about that. Now this week I had a situation where another staff member's husband thought he had COVID, got tested. It was negative, but what we addressed it in the meantime and said, okay, because we've gone through this, and we're going to ask that you wear a mask at all times in the office, whether you're in between patients or whatever. So she had the N95 on with the patient, surgical mask, a level 3 on when she wasn't. During lunch, she actually took herself out of the office and ate in her car because she did not want to take the chance of exposing any of us. So she was very cautious about it, but it's made us all have a heightened awareness of what we're doing and how we're doing, but to make sure that we're being very careful with even around each other. But yeah, it is kind of a scary thing when you get a call, because what started it, I called the health department and they said, well, because the husband was a contact, no big deal. But then when he actually got tested and on his own, because of his children's safety, they weren't even going to test him. So that's kind of scary to think if they weren't even going to test him and he went, in fact, the only way he got the test, he lied to them and told them he had a fever. That was the only way he got in to get the test. If it hadn't been for that, we don't know how much farther the exposure would have gone with it. So that's kind of a scary thing, but to make everybody have a heightened awareness, who you're around, keeping track of that, and then making sure that if you have symptoms or you think then making sure you're taking precautions. And I appreciate my team member this week who stepped out and said, I'm going to step away until we know for sure. So, she took the time off and ate in the car, made sure she stayed away from all of us, and even socially. She said, at home, I'm going to stay at home, not do any shopping or anything until we know for sure. So that was I appreciated that fact with her.
So let's start by seeing what lessons we can learn from Marsha from your experience, because I think that's important. I love it. We can all learn lessons and we don't have to do all the stress. You went through the stress and we're going to learn the lessons, but that's the way it works sometimes. So the first question is, as office managers, we're in charge of, with the doctors, of course, the entire operation of the office. What are the rules of the road that we should put in place for how the staff members, how the team members interact with each other? Because I definitely think that, most dental offices I've been to, I haven't been to one since the COVID-19 hit, is we're very concerned about how the team members interact with the patients. Let's talk about how the team members should be interfacing with each other, even if you don't have COVID in your office today. Because one of the things that came out is if you have somebody who has COVID in your office, you have to close, you have to call all the patients. I mean, it's not like, oh, someone goes home and they have a little bit of a flu. This is a big issue. So let's talk a little bit about, as office managers, what are the guidelines that we would give out for how the team members should be interacting with each other, whether it's when the patients are in the office, during lunch, after hours, that kind of thing. Amanda, I see your back. Can you speak up so we know you're there? I don't see your face, but your mute is off. Are you here? Oh, still not here. All right, we'll move on. So Elizabeth, can you talk a little bit about what in your office, based on Marsha's story, or what are you doing? What are the rules of the road for interactions between team members given the COVID-19?
Well, we're staying at least the 6 feet apart. Sterilization.
Always.
Always.
Always. So the first rule of thumb is everyone stays 6 feet apart.
Correct.
All the time.
Yeah.
Okay.
All the time.
Except I think when you were working four-handed, right? If you're working four-handed, you can't. So basically, whenever possible, we're 6 feet apart all the time.
6 feet apart.
That's
Sterilization, 6 feet apart. Lunch, I do have a nice break room upstairs, microwaves, refrigerator. Everybody grabs their lunch, warms it. Everybody's eating in their car. Mask on. Even at the front desk, we've got the mask on. We've got face shields are available. However, I did put the plexiglass up in the front so that, any interaction from the other side of the counter doesn't come into the workspace there. And I think we just all have to be very careful. We're taking the temperature. Everyone's got a clean clinic jacket on after every patient. Even the front desk has clean clinic jackets. They don't change after every patient. However, twice a day, there's many as they need for them to change into. We leave all the dirty laundry there. Shoes, everything stays there. Everything gets laundered there. So, and outside, all of the ladies in my practice have small kids. So they are extremely careful, because they don't want to take anything home. They've got the hair cover. We're doing probably more than we should, but I want everybody to be safe.
Is there such a thing as more than we should? I would argue, I'm not sure these days. But anyway, it's good. It's good you're doing everything.
More than
That's
what
good.
the CDC is saying.
More than the CDC is not a bad thing.
Right.
Beverly, how about you, Beverly? What are the rules of the road, or what are you going to do, even based on Marsha's story, as far as how the staff members, the team members should be interacting with each other?
So 6 feet of distancing in our office is just not real for us. It's just impossible. And I think in a lot of offices, maybe in tighter spaces might be the same. It's just not a real factor that we can remain 6 feet apart completely while we're there. So the biggest thing I think is accountability, holding each other accountable, and having those communicating together the discussions. Kind of like Elizabeth said, a lot of them have small children. Nobody wants to take anything home to their children, and they're communicating those things together about kind of what I said earlier, responsibility, even when you're out of the office, being responsible about, keeping yourself safe. They are obviously where our cleaning has become, we've always been a clean practice, I would like to think, but it's probably amplified 100 times. We're wiping things down once an hour. Patients notice, they say, you guys are coming outside, you're wiping the door. We're limiting patient contact, but that's also obviously making sure that the team members, even team to team, because of things being wiped so much between each other, and anytime somebody uses the restroom, employee bathroom, or anything else, it's completely wiped down. They are wearing, obviously, all the appropriate PPE, even at the front you know, the front office part as well, plexiglass, other things, but them together maintaining a 6-foot social distancing is not, it's just not realistic. So we're doing the best we can, obviously protecting ourselves PPE wise. They know they are holding each other accountable for taking their temperatures. Don't come in, you know, until your temperature's done. Did you change your shoes? So I think they're, you know, as managers, I don't want to sound condescending when I say this, but these are like our children, you know, and we care about our children. These are the good kids, not the ones we don't. These are our good kids.
Not the ones we don't
want to
like.
make sure that we care for them. Exactly.
Right.
We want to make sure we care for them, but you kind of have to remind them a lot, you know, each other. Don't hug each other all the time, or don't, you know, so it's a lot of reminding and communication and making sure that they love each other too, you know, so they want to be connected, and this is their outlet. You have to remember, everybody was quarantined for so long to their homes, you know, a lot of us. So when they got back together, it was kind of like, oh, you know, a love, and I'm like, not too close.
Gotcha. No, that's a good point.
So one of the things that I wanted to mention too is what was frustrating for us is, so the employee who had COVID at our office, what was interesting is after her husband was diagnosed with it, his employer then implemented that everybody at work had to wear a mask. So it was interesting that here we are doing all of this stuff, but here was an employer who, until somebody got COVID, didn't have, and they were all working in close contact in a factory, and they weren't having to wear masks. So it's like, so here we're being very, very careful, and that was really frustrating for us. We're being very careful, but then, you know, somebody that wasn't, it was like, you know, to put the mask on after you've already got the diagnosis and your, you know, all the positive results, it's not the thing. The other thing you were talking about, the health department, is one of the questions I came up with the health department is like, why are you changing your mind now that we have to contact patient? And their response was, the patient didn't have a mask on. It's like, well, we can't work on a patient if they don't have a mask on, but our staff had everything on. Well, still, they didn't have a mask on, so that's why you have to contact us. So it's like some of their things didn't even, so things don't make sense, but I think it was an education thing for them, because then they went back and talked to the state and reversed their decision. So like I said, it's all a learning game, but interesting, you know, we're all doing all the precautionary things, but, you know, there's always those, you know, there's always going to be a way to get it. And that's kind of what we've talked about. You know, we're going to get it eventually. You're going to be exposed somewhere, somehow. Our question is, what about the person at Walmart? You know, the cashier, if she's got, are they contacting everybody? I mean, they're not even doing what we're doing. And one of the things that came up last week with one of my hygienists was telling us a friend of hers passed out while working on a patient from wearing the N95 mask. So there's safety concerns. So not only are we taking temperatures, but making sure that we're doing the pulse ox for everybody and checking oxygen levels, because by the time this hygienist was taken to the hospital, her oxygen level was down to 50%. And one of the things the doctor said was he felt that dentistry was going way over trying to protect our patients and our staff, but they also felt they were putting us at a little bit of a health risk because of having to wear the N90. This office required the N95 from the time they walked in till they walked out. They only took it off when they were eating lunch. Other than that, it stayed on, and it's causing a health concern. So this is another question that's come up. Yes, we're all trying to be protective of each other and take care of everybody, but we also have to make sure that we're looking at things from a health perspective. We're doing the best health-wise.
So one of the things, we had a question that came in, Marsha, while you were speaking, and that was, what state are you in? And I know the answer is Wisconsin, but I think that begs the question, and I think this is one of the things that makes this pandemic very challenging, in my opinion, is that we really don't have a national sort of strategy, right? So it's state by state different. It's states are doing their own thing, and then even within dentistry, there's the ADA guidelines, which are sort of mostly based on the CDC guidelines, but then there's the actual state dental, health department. So it's very confusing to those of us who have to work within the system, sort of what guidelines to follow. Hopefully at some point that will get worked out. I think that's the situation we find ourselves in today. Marsha,
and one of the things we're seeing is even the health departments, county by county, the health departments are even different. 2 different counties, they have 2 different sets of rules.
So one of the things I just wanted to respond to what Marsha said before, and that is, well, you know, I understand that it's frustrating, but at the same time, we're a dental practice, so therefore we are a health provider. So I think it's logical to say that the expectations for infection control in a healthcare provider would be higher than a factory and stuff. So that's where I think it comes from. But at the same time, it's very frustrating that there's no uniform sort of answer for all these things, no best practices. I am going to have a conversation with a friend of mine who who is a higher up at the ADA, I love to see the ADA take a little bit more leadership here, because I do think that dental offices are strange environments. You know, they're healthcare providers, they're different than medical offices, but basically I'd love the ADA to sort of come out and say, here is the best practices if a staff member comes down with COVID, and here's how to make sure you know what you're doing around that. And then if you have a team member comes down, because I do think the health departments probably would take their cues from the ADA if the ADA spoke very clearly about what to do. I don't know if anyone else has any ideas about that, but it's frustrating, you know?
I also think that part of the reason that they haven't come forward with a stance like that is basically because, you know, dental offices across the whole entire country vary so differently. You've got some that are New York City, you've got some in North Dakota. And so those rules shouldn't necessarily apply to the same, there should be based on population or other things like that, based on the number of patients you see. We obviously know how this, you know, virus, just tracking it through the United States, has, you know, how it's very amplified in some areas and not in others. And now we are seeing respikes in certain areas and other things like that. So I think that's probably the why. I agree with you. They absolutely should put something out, but I think that's the why of why they haven't, is because they don't want to limit those people who are in those, you know, very areas where it's minorly touching them. They're not feeling it the same as they are like New York City or, you know, Chicago or a lot of these other cities.
Not disagreeing. And what I would say is, I think there's a lot of people in dentistry out there who don't realize the stress and drama that awaits, not to mention the health risk that awaits when it hits your practice. Because I think everyone would agree, the numbers would show that a good number of dental practices in the United States are going to have a COVID situation in their practice. I mean, it just stands to reason, right? So I think there's a lot of practitioners and staff members who aren't quite thinking about, oh my God, if this happens, now what, right? So I want to pivot a little bit, and I want to say to Marsha, talk a little bit about, if you would, what it was like to call the patients and how did they react? You said before that some of them were pretty good, because part of this issue is the team members and them coming down with COVID, but the other part of it is having to call the patients and say, hey, guess what? We have a situation where you may have been exposed. Talk for a few minutes about what that was like. How stressful was it? How did you handle it? What did you say?
Well, it was really hard, you know, for the one patient who was 85 years old, who hadn't left her house during all the quarantine except to walk to the post office, decided that she wanted to come see us, and we gave her the option of rescheduling, but she came in. So to call her, she's like, right away, it's like, well, I have a doctor's appointment. You know, what am I going to do? Can I go? And it's like, I don't have the answers, but the health department was going to be in touch with her. So just reassuring her and letting her know you know, I didn't say it was nothing because I didn't want to downplay it, but just reassuring her that we were doing the best we could and that we wanted to let her know that the health department was going to call her. So she got a call ahead of time. And then following up to make sure that the health department called back and told her that there wasn't concern because we had all the precautions in place. The other patient was concerned because they take care of a grandchild. And so he was wondering, because he had been around his grandchild for a couple of days. So he was worried about that. And then also, he hadn't been told he had to quarantine yet, but from our perspective, we were worried, you know, what happens now? He has to be off work for 2 weeks. You know, I feel bad. Here's my patient who's going to be without work for 2 weeks and not collecting, and, you know, of no fault of his own. But we had the conversation with him. He felt reassured because he had sat in his car. He came in, went right to the office thing. And so he didn't feel like he had been exposed. We couldn't tell him it was a staff member because of HIPAA. We just had to say that he had been exposed to somebody with COVID. So I couldn't, and even the health department will not, when the health department told us when they call the patient, they simply just tell them that they've been exposed. They don't even tell them where they've been exposed at. All they will tell them is that they've been exposed. So we were actually telling them that they had been exposed by somebody in our office, but, you know, things. What raised a concern is when I had to call the patients and cancel, let them know that my husband was being quarantined because he had been in contact. We had a lot of fallback from that, patients calling, you know, we're saying we're back open now. And they're like, is he okay? Did he have COVID? We don't want to come in if he had COVID. So we saw a lot of that perspective now. They're worried about coming in if he had COVID. Not that the staff had COVID. And we didn't disclose it, our staff. We just said he had been exposed eating lunch with somebody without a mask on. And so we went that route. But it's raised a lot of questions for them about, you know, are we safe to come back into the office? So we've had to have a lot of conversation. One of the biggest takeaways we made sure we had a team meeting. We all were on the same page. We're all saying the same thing. So everybody's explaining things the same way. And everybody, you know, we all had the answers to the questions that were going to come up.
Got it. Elizabeth, do you have anything you want to add as far as the conversations with the patients or any recommendations?
probably be the same way that Marsha, you know, because with HIPAA, we can't disclose who they came in contact with. So it would just be that conversation to reassure the patients that, you know, the health department will be in touch with you, because I know here in Houston County, it would be the health department, you know, after we contacted them. So basically the same thing she said. You just got to reassure the patient and let them know that we're still here for you. You know, we will be back open, and, you know, moving forward, this is how it's going to be.
Mm-hmm. Now, someone asked on the Q&A, does everyone have N95 masks and full gowns worn by the front office people in their offices?
No.
What's the clothing protocol in your offices for non-clinical employees? Elizabeth, go ahead.
We're doing the level 3 surgical mask, which, you know, I was told we could do level 1. I want to kick that up a little bit, so we do the level 3. I don't do full gowns. Everyone has on a longer clinic jacket that gets laundered. And then they have the shield, the plexiglass shield in front, but they also have access to the face shield if you feel more comfortable wearing that also.
Mm-hmm.
And everything's getting wiped down. We don't allow the patients to come in the practice and sit down in the reception room. Actually had a patient the other day that said, I know your reception room is closed, but can I go to the bathroom? Like, absolutely. But as Marsha and Beverly said earlier, it's immediately cleaned. I mean, when they come out, we're standing there in full gear ready to clean it, and they see that. Mm-hmm. So, you know, we don't allow the patients to touch any, you know, the front doorknob. We do all of that. We escort them in, we escort them out. So,
okay, Beverly, how about you? How about what the clothing protocol for the front desk and anything else about what Elizabeth was talking about?
So we are giving them what they want. Ultimately, we want to give them whatever they want to feel safe. So if they want an N95 to feel safe and they want to follow,
you're talking about the staff members, not the patients.
Staff members, staff members, correct.
Okay.
Patients, obviously, we've told them they have to wear a mask while they're in the office, and we have the same thing as Elizabeth. We don't have a reception area right now. It's, you know, they're in the door and they're immediately escorted to their sterilized treatment area. We did put out protocols to patients, and everybody is getting them. And we've actually gotten quite a few new patients, because we have our current patients that are sending our protocols to their friends, and their friends are like, well, I want to come there because you guys are doing all of these things. So we've actually gotten new patients from just putting out what we're doing. The team, as far as the team goes, giving them whatever they feel safe. They need to set that bar for you, and they need to say, this is what I need to feel safe working here. And you can meet it or you can't. Okay. I mean, not every doctor's going to, you know, some people can't get N95s. I get it. That's a probably different discussion for a different day, but you have to give them what they're going to need to feel safe. So if that's a level 3, if that's a level 1, if that's a face shield, if it's whatever, if it's installing plexiglass, whatever it needs that they want, most of it's, you can meet it, you know, unless you have somebody that's completely unreasonable that really is going to set that bar so high that you physically can't reach it. And then that might not be a team member that is really on your team. So that might be something you have to think about, but ultimately give them what they want to feel safe. It's not a huge expense to you. And if it's also going to protect you in the long run, if something does happen, like a situation that Marsha went through. Got it.
Good. Amanda, are you back? Amanda. All right. Well, Amanda, we missed you. All right, good. So I thought we would move on. There had been one other question that came in on the Q&A about this was someone said that they were going for a medical elective procedure, and in order to get that procedure done, they had to fill out an entire disclaimer and waiver and the whole thing before they even visited the medical practitioner, the physician's office. Is anyone doing a lot with waivers on the dental side about having patients sign things? If so, is there a form that you can share, and where did you get it, and the whole thing? So Beverly, since you have the floor, why don't you start? Talk a little bit about how you've upgraded your waiver process, what you're using, and the procedure you're doing as part of your post-COVID-19 opening plan.
So ours has changed a couple of times. Honestly, it started out really in depth and now it's gone to really short. So I think that's happening as, you know, you've got to try to save time. So initially it was this kind of long waiver of this is aerosols and this is what happens and this is what happens in a dental visit. And, you know, patients don't read all of that anyway. So now the way our process is working right now is we actually have a little patio area. So in one location we have a patio area, and the other location we actually have like a lobby type of area. So we meet the person person there. They call from their car. We meet them there, and that's where we handle their screening. So we sanitize them, basically hand sanitizer, all of those things. We give them a pen that hasn't been used by anybody else. We have a clipboard that we sanitize. The clipboard has all of the COVID screening questions on it. At the bottom, it states, I understand that I'm having a dental procedure today. I understand certain risks come with that. And they sign that form. They keep the pen, they come in, they wash their hands again, rinse, and then they're to the back. So it is putting some administrative time into things. I think the front office is picking up a little bit more. They're a little more overwhelmed now than they used to be, because a lot of that stuff happened in the back, waivers and other things. It's now happening in the front. But yes, they are signing one, and it was very, very long. And now it's kind of like very basic. I understand I have a dental procedure. I understand it. There's a certain risk that comes with that during COVID-19, and I'm saying yes, I want to be here.
Got it. Good. Thank you. How about you, Marsha?
So we got ours. We started with somebody else who had one that we had adapted, and then now we've picked up the one from the ADA. Same thing. It's asking the pertinent questions, putting their temperature on there, and it's got the waiver on the bottom, letting them know that they are taking a chance and, that they're okay with that. We actually laminated ours, so it's really easy to wipe off. So we have it there, they read it, and then we have an electronic questionnaire. So then they do a signature, and we are wiping because we have an electronic signature pad, and we're just wiping the signature pen off in front of them, so they know that it is being wiped off with each patient and letting them know. I think that's been the big thing, is letting the patient see what we're doing. Sometimes they think we're overkilling, but at least they know that we're wiping everything down, and that we are, when I'm in the waiting room, as people are coming, going, wiping things down. But yeah, as far as the form, we've shortened our form up a little bit, but just asking the questions. And then the other thing was training my staff. What happens if somebody says yes to a question? What do you do then? Rather than panic, it's like, okay, what's the question? We've put a note box on there that we can put in a note. Somebody tells us, yes, I have been exposed 3 months ago. My son had it, but it's been a 3-month window. Or yes, I work in a hospital and I'm around COVID patients all day. Then our next question is, are you wearing all the protective gear that you need? So it's just things like that. But, making sure the staff can answer and handle if you do get somebody that does read and check off yes, because that's the thing. A lot of the patients like, yeah, we know what it is and we don't. Frustration with patients that they're filling it out every time. So if they're in last week for hygiene and this week to see the doctor, it's like, why? And we just tell them, this is our new normal. This is what we have to do to protect you and ourselves.
A lot of it is what you say and how you say it. There's no question, Marsha, absolutely. So Marsha reminds me of a story from years ago, and I think it's still true today, about why we do these things. So it's the old stories when you get on a plane and you take down the tray table and you figure out there's a huge stain on the tray table in front of you. The first thing you think is, oh my God, I bet they don't take care of the engines either, right? So cleaning the cabin of the plane is important, not just to clean it, but also even pre-COVID-19 and post, it's also to send a message to the passengers. We take these kinds of things seriously, and this goes to how we handle the maintenance. So what you were saying before, Marsha, makes a lot of sense to me. We've all got to have these protocols down, even when it's not in a clinical setting, so that when patients get to the clinical setting, they have in their mind, well, these people took a lot of care to give me a pen that was new to me and wipe everything down. That must also mean that they're taking equal care or more care in the clinical setting. So very, very important.
What's been interesting is our older patients, when we first started, our discussion was, a lot of our senior citizens, we didn't think would come in. They would be afraid. And they actually are coming in because they feel like we're a safe place to go. They haven't gone anywhere else, but they feel like we're safe to go. So that's kind of it makes us feel good that they feel like that we're safe and that we're doing something right.
It makes you feel good, and it's also a big responsibility. I heard you say before how hard it was to call the 87-year-old patient or 85-year-old patient, and she had trusted you with her health, and you had to call her up and say, guess what, we might have an issue. And that must have been very difficult. So I can only imagine, because the trust is so important between the practitioners and the patients. Elizabeth, anything to add?
I was just going to say, we do a pre-screening on the phone anywhere 24 to 48 hours prior to the patient coming in. And then I have 2 consent forms, one for elective treatment and one for non-elective. Elective being their hygiene appointments, and then non-elective for emergencies or anyone that needs, anything other than elective, which would be, do we have a filling? Do we have a crown? Do we have an abscess tooth? Any kind of treatment like that they're coming in for. So I actually have 2 different consent forms.
Can we try to make sure to, I'll say this to Leah, who's managing the behind the scenes here. Let's make sure that we get from, if you're willing to share it, from the ladies on the call, the samples of the forms you're using, and maybe we can get them out to those who participate and or post them somewhere so people could check them out later. I do think there's a lot of good stuff. One of the things that rang true with me when Marsha told her story in the beginning here was there doesn't seem to be a lot of consensus around the legal end of these things yet. I mean, so they're supposed to be passing a bill in Washington that basically holds everyone harmless for people catching COVID-19. I don't think that's actually happened yet, but the insurance company, but basically waivers and disclaimers, I think, are going to be very important in the short term. So let's make sure we
And
do
I
that.
had the lawyer, my lawyer did all these forms for us. So I don't know if that means anything, if they're legal or not, but
when we were choosing which forms to use, we kind of went with what's the strongest one, where's all the pull coming from. So I think the hygienists, obviously we all kind of know the hygienist risks, seem to be a little bit higher than most people in the practice. And the hygienists have been very vocal about that through social media avenues and other places like that. And I think with that, we decided to use a lot of the things that the hygienists were recommending, because then I felt that they would feel that they were able to be a part of that. And it was going to be the most stringent thing that we could do. So I think we chose to go the hygiene route because we wanted them to feel like they had the power or control over it, which they did, and I wanted them to feel safe. And so we kind of let them decide and make those decisions, because I think the hygienist being as vocal because of the risk factors that they have was important to include them in that part of the process.
Elizabeth,
I would also say that your assistants are they're as high up there as your hygienists, because they're in the aerosol spray with the doctors as well. So I know in our practice, if the hygienist has to pick up the Cavitron or something, we use the leaf, suction for that. And that way you don't have to have an assistant in there with the hygienist or anything.
Yeah, absolutely. Giving the tools to the hygienist so they can make it as safe as possible is really
Absolutely.
important. And what I can tell you from my point of view is we're only in the first inning of this game. Not that, baseball's coming back, maybe only for 60 games, but it's a good use an analogy to remind us that baseball's important. But I do know there's a lot of good PPE coming down the pike as far as aerosol protection and some other things. So stay tuned. We're really only in the beginning of this battle. I really am confident by the end of the year, we'll be seeing some new products on the market that will make what we're doing even more effective. It's just, we're trying to fight a fire without the right tools. We all recognize that, but there are more things being invented all the time, and you'll see some more of those come along. One of the questions that came up on the Q&A, which is really a question mostly for, I'm sure, for office managers or those who work the front desk, is simple one is, we get the patients, but how do we keep people from just walking in the office?
Keep the doors locked.
Lock the door.
Lock the door. All right, lock the door. And all right, so, and what do you do when someone sort of wanders in? Maybe it's a Benco sales rep, maybe it's something like, what do you do when someone who's uninvited comes in and the answer is, I'm sorry, you got to leave? How do you handle that?
We put a really big stop sign on our door. So there's now this really big stop sign, and it's like stop. And then there's a sign to one part of it that says, if you are a delivery person, mail, UPS, FedEx, leave the package right here. Don't come in, call first. So I think I've seen some people come up with some brilliant things, those little A-frame signs, like you see, out in front of storefronts.
A table tent.
Like stop, table tent sign. Yeah. So I've seen all kinds of creative things come around.
Any other ideas?
We kind of took a different thing. Our waiting room is empty because our patients are coming directly from their car back. So I don't have a problem if they walk in, as long as they're the only one in. They're usually wearing a mask, but I want to help them. I want to be there. They've got questions. They want to but they're in there briefly. So we make sure they're in, they're out. We answer their questions. We've gained a lot of new patients that way, by being able to answer questions, because they're coming in. They want to know if we're safe, if we're back open. So a lot of times, because we're in a small town, so they're walking by and they just want to stop in and say hi and make sure that we're all okay. So we've welcomed them in and let them know we're here and there, but we also make sure we keep our waiting room, and even the staff, if they're dismissing somebody, they'll hold them until we make sure our waiting room's empty, or make sure that they do keep that distancing so we can keep them. But we've let them in and let them know that we're there and we're back and we're okay.
Well, let's build on with something that Marsha talked about, because I just think it's so critical, and it's actually a good place. We're getting to the end of our 1 hour time in a few minutes, so let's see if we can keep this one going until it's time to go, because it's uplifting. Is what are the one, two, three things you've done to really grow the practice since COVID-19? Everyone, I think, has been pretty negative, and there's a change in dental thing. I heard Marsha say, well, we're gaining new patients, right? What are you doing to gain new patients? What are the messages you're sending, and what successes have you had in adding patients to the practice since since you've reopened a few weeks ago. Elizabeth, anything you can share as far as a
I
growth
would say
strategy?
basically like Marsha, word of mouth, our patients coming in, seeing everything that we're doing, taking that back to their friends and family and just saying, hey, you know what, I was at the dentist today and, they've always been clean, but now they've really kicked it up. They won't let me in the front door until I call and let them know, hey, I'm here. Yeah, that to me, that's the word of mouth is what's getting us the most patients, kind of like Marsha.
Mm-hmm. Got it. Okay, Beverly?
Communication, email communication to our patients, sending out those policies and procedures that we're doing now. I think one important thing to make sure that stays consistent through your messages to your patients is that you've always been a safe place to come. Now you're making it even safer, but you've always been super safe, because our patients would respond to those emails. Thank you so much for taking care of me. And, I kind of mentioned earlier, they would pass those things along to their friends and say, look what my dentist is doing. And then their friends would call and schedule an appointment. So I think communicating definitely with them about everything that you're doing. And I also think that a big part that's a good thing to use in regards to just your general marketing and other things right now is you guys have all this new stuff. There's new gadgets and gizmos and things that you're adding to your chairs and these air purifiers and, in your all throughout the place. Post this thing, post this, put this on your social media, say, hey, this is what we've got. This is what we're doing. They probably never even knew you've used a leaf before, or, system in the patient's mouth. So these are things that you can show them. You can take a picture of it. You can do something fun, and that's promoting out there, but it's also promoting the safety of what you're doing. And people are going to see that, so now you have something fun to, to promote, I guess. And I don't know if an air cleaner is fun, but
Listen, this day and age, an air cleaner is the most fun you can have with your clothes on. It's all good. Marsha, how about you? What are you doing to grow your practice, or what has worked so far?
So like Beverly said, communication, we're sending out emails, letting them know, being upfront that we were open a week, because we sent out a big announcement. We're open, we're back, and we're going to be looking forward to seeing you. But then, having to send another message out a week later going, sorry, but we were upfront, letting them know doctor had been exposed. He had no symptoms. And so just being at communication and being open and honest with them, because I hear a lot of people going, oh, the coffee shop was open, but now they're closed, and now they're open, and now they're closed again. And they all wonder what's going on. Are they closing down? So they wanted to know where we were at. So we were being honest with them, letting them know what was going on, that we're back open. We've sent out emails telling them we're kind of doing a soft opening. People are wondering about getting rescheduled after having their appointments canceled. We're letting them know I have 550 people to reschedule, and we're doing the best we can. So have patience with us. They're being really good. A lot of our new patients are emergencies because we were closed. The doctor's schedule wasn't very full. We've been filling it back up, but being able to handle the emergencies that are walking in, everything has been going on. They've been off work. They haven't done anything. And now they've got a toothache. Being able to say, yes, we can get you in this week and take care of you. That has brought in a lot of new patients for us, because nobody else was willing to take them in, because they're only seeing their patients of record. They're not taking on a new patient. We were willing to say, yeah, we'll take on a new patient. We can't do a cleaning, but we'll take care of the toothache and get you out of pain. And that's brought a lot of appreciation from patients to us, and a lot of referrals.
I think you bring up a really good point, Marsha. You bring up a really good point in regards to make sure when you're communicating out to your patients that you are in a soft opening. This isn't, gung-ho, we're bringing everybody in like crazy, because the patients are, first of all, they might be calling. You are doing new procedures and protocols in your offices right now that might be taking more time. You might not be able to grab that phone, right at that minute. So I've ultimately updated the voicemail to say, we're in a soft opening, please bear with us. And, patients have been very complimentary to us, just as we have been to them. They understand, they really do. And for the most part, all of our patients are really good. And if you have those ones who really just want to give you a hard time about it, you might have to make some choices on that one. You might have to make I've said this before in these groups. We are all working way too hard right now. Our providers can't breathe barely with these masks on. Yeah. So ultimately, do the best you can, give everybody the best you can. But, you also they have to respect you too. They have to love you right back as much as you're trying to love them. So.
Well, and the other hard thing that we ran into is one of our staff members quit. One of our hygienists quit. So I'm short staffed now because I can't find anybody. There's not a lot of hygienists, or the ones that were available are working extra hours in their offices. The temp service doesn't have anybody. So having to call and cancel future appointments because we are short staffed. So that's been a big issue. And we know that it may turn around now once the unemployment issues end here, that maybe in August, September, we're going to have people available. But, having to be able to apologize to patients that we're doing the best we can with but being honest with them, they really appreciate that knowing that we're going to do what we can to help them out. And I think the communication with that has been a big thing for us.
I love this idea of the soft opening. I think that's really a smart idea. Thank you, Beverly and Marsha and Elizabeth, for sharing that. The other one is, I love this idea of really strongly communicating clearly what expectations are. That's very important. And I'll add something else in there that was sort of hinted at a little bit, but just to make it very clear to everyone who's on this webinar, we have to make everybody aware that we are accepting new patients. My suspicion is that some people out there may not even think that we're accepting new patients. So just sending the message very clearly, as Marsha said before, we may not be able to get you in for a hygiene appointment for a little while, but we are accepting new patients. We are not just seeing the patients of record already, and I do think that that's very important. And I'm glad to hear that. I think most of us are looking for an opportunity to grow. My suspicion is that many doctors out there are not clearly sending that message. They're saying, well, we're not sure, we don't know. Send that message if your practice is in fact doing that. So we're almost at the end of our time. I figured we'd end with, I just give each one of you, invite all of you. First of all, I thought this was a great webinar. Thank you very much for everyone participating. Elizabeth, starting with you, what's the one bit of wisdom that you would share with everyone on the phone today from the perspective of the webinar, from the perspective of an office manager? What's the one bit of wisdom to share that you want to encourage everybody to keep in mind, or that you learned along the way here?
Well, you know what, and I hate the saying we're all in this together, but we are. So, we've got to handhold our patients. We've got to handhold our team members. I wouldn't ask my team members to do something that I personally wouldn't do myself. I think the line of communication has got to stay open between the doctor, myself, the team members, and the patients.
Great, thanks. Marsha, how about you?
I guess the big thing is that knowing that as an office manager, I have to be the calm one if they see me panicking. So I have to be the duck. I'm calm on top of the water, and underneath I'm paddling like crazy. We've bought a lot of chocolate because our staff, when we get stressed, we eat a lot of chocolate. So we've gone through a lot of 5-pound bags of chocolate. So it's just, being the leadership with them, showing them that I'm okay, I'm calm. They're like, what are we going to do? And it's like, we'll handle it, we'll do it. So my calmness has really helped reassure them. And even like now this week when things have come up, or another staff, they're like, what are you going to do? And it's like, we'll handle it as we go along. We just take it as it comes. It's like the river. You've got to be flexible. If you're really trying to be hard, black and white, it's not going to happen. So we're flexible. We have plan A, B, and C. Sometimes we're on D and E and F, but all the staff knows that we have plan A. This is what we'd like to do, but here's plan B, C, and D that we have to do it. So we've talked about that in our staff meetings weekly. We talk about what were the bumps in the road and how are we going to overcome those. So just knowing that the staff can come to us and get their reassurance, and that they see how calm we're handling things, and they feel a lot better about it.
Perfect. Thank you, Marsha. And Beverly, how about you?
So don't be too hard on yourself. We're all doing everything that we can right now. Trust that you're doing the best that you can. Don't be hard on yourself. If you make $1 today, it's better than you probably did all of April. So don't be too hard on yourself. Hug your doctors, hug your owners, because they need it. Okay. They're dealing with this from the production standpoint.
With a mask though, with a mask.
Yeah, right now. We're gonna
elbow bump, right? Elbow bump. Elbow bump. Yes, with a mask, but high five them, whatever you can, with gloves, fine. But they're feeling a lot of the owners are feeling a lot of strain and pressure right now. And not only from the production standpoint of the practice, but the financial aspects of what they're trying to do for their teams as well. And they need a little love sometimes too.
Thank you. Well, there's no better way to end a program like this than with the idea of love. So thank you very much, Beverly, for sharing. Thank you, everybody, for being part of today's conversation. Hopefully everyone who's listening found it helpful. I found it to be very exciting and interesting. And thank you, all three of you ladies, for sharing. Sorry, things didn't work out for Amanda, but we did have more than enough experience here to answer all the questions. With that, I'm going to say thank you, and I'm going to turn things over to Kay to talk a little bit about next steps and upcoming programs. Thank you again, ladies.
Thank you. Thank you, guys, and thank you, Chuck. An amazing, amazing panelist, and great questions. And you covered so much amazing information. And you know what? We'll have to just do this again, because I think that I would love to even hear more about how you're handling the pay and what you guys are doing in that. So we'll have to do more of that. But you did an amazing job. So thank all of you. So I just want to say we do have some upcoming webinars, and if you will take your phone and actually scan the QR code, it will give you everything that you need to know about what's coming up. So we have that ready for you. If you'll just take your cell phone, scan the QR code, we'll be able to send you everything right away. And with that being said, I want to tell you about our next week webinar with Dr. Moorhead. We call him Dr. Checklist because he's going to really be going over some amazing checklists that he's now implementing into his practice, and he's going to be sharing those checklists with you. You will be able to receive keys for this webinar, and it's going to be an afternoon webinar on Wednesday, July the 1st from 7 to 8. Then we have some amazing workshops. Some of the speakers that have spoke for us have actually putting on some workshops that you can actually learn more about what they're delivering. So Laura Owens' medical billing is something that I feel like, you know, we're all going to. So if you're interested in learning more about how you can bring in more money to your practice and also help your patients, this is a workshop that you might be interested in taking. It's a 2-day workshop. It's going to be on July 17th and July 24th. The fee of $125 covers both days, and each day is a 2-hour session, along with an amazing workbook that you will receive and some good one-on-one time too if you need that with Laura. So please make sure, if you're interested, let us know. The next workshop is Roy Shelburne. So Laura does medical coding and Roy does all of the insurance coding. On this webinar, Roy is going to be telling you how to get paid for some of those procedures that we can't get paid for, and also tips on, you know, negotiating your insurances up those fees. So this is another great workshop. It's going to be on August the 21st and August the 28th, both days from 12 to 2. And again, this price includes both days. And then Catherine Eitel, you know, she's like the queen of communication. So if you really want to improve your communication within your office, please sign up for Catherine's workshop on September the 11th and September the 18th. Again, it's going to be 2 days, and each day is 2 hours, but amazing workshop, great information that will help support you and your teams moving forward. And with that being said, if you have any questions or if you have any input that you would like to see us provide for you, a webinar or a workshop, please let us know at practicecoaching@benco.com. Again, that's practicecoaching@benco.com. We really want your feedback. With that being said, I'd like to end today's session by thanking everyone. I won't give you a hug, but I'll give you a wave. Everyone, thank you so much. You did an amazing job, and we will see you soon. Bye-bye.